Hello. Many of you may be thinking that, what is this sinusitis? Some people who have a chronic headache could be just be because of a migraine and you're thinking it is from sinusitis. And some people who are suffering from just allergic rhinitis think that they have sinusitis. The Nasal Polyposis Syndrome Awareness Day, which is created by Euphoria, has a theme of redefining the patient journey in this sinusitis. And let's see what actually these sinusitis are. Chronic sinusitis is just nothing but when the soft tissue inside your sinuses actually kind of a swell up to some reaction of the environment. It's a kind of an immunological and protective reaction that your body develops, but it fails to get back to its previous origin, and that is when it leads to chronic sinusitis. What are the symptoms of sinusitis? When you have any of the two symptoms that I'm going to mention below now, for more than 12 weeks' time, we consider it to be a chronic rhinosinusitis. It could be your facial pain or a headache. It could be reduced or loss of smell sensation. It could also be when you have a frequent post-nasal drip or the thick irrigation in your nose, or it could be just a stuffy nose. So if you have two of these symptoms for more than 12 weeks time, it will be considered as chronic sinusitis. There is also a variant called as a nasal polyp syndrome, where often a polyp develops in sinusitis patients. And did you even know that 50% of polyp patients can have asthma as their comorbidity, and hence for the patients who have asthma, it is very important that we evaluate for asthma too. What are these nasal polyposis? These are just a bunch of grapes, kind of an extra growth, the mucosal growths that we see inside our nasal cavities, and it is not malignancy. That means that it is not a cancerous swellings. Why do we even get sinusitis? It could be for various reasons, or sometimes we may not even know the specific reason. But the most common reason that the sinusitis can occur are from allergies, from the pollution exposure. Sometimes it could be genetic, it could be hormonal, it could be your direct or indirect or the passive smoking, and sometimes it could even be from immunological conditions such as autoimmune disorders, which can lead to sinusitis too. How do we even diagnose sinusitis? Most often, when you have these symptoms, your doctor will have a high degree of suspicion for this diagnosis, which is confirmed by a direct examination by putting a small tube inside your nose called as a nasal endoscopy, and sometimes also CT scan, nose PNS. Doctor might also do some evaluation to see the cause, like some skin prick allergy test. How do we treat chronic rhinosinusitis? Depends on the severity and the type, whether you are presenting with polyp or without nasal polyp. Most of the time, the treatment begins with sinus rinses, nasal corticosteroid sprays, and if the obstruction is too much and if the symptoms are quite recurrent, we might need to do surgical interventions called as a functional endoscopic sinus surgery. And so also sometimes post surgery, we might add certain treatment called as in immunotherapy or biologicals, depending on the severity and cause of your disease.